All right, so this article looked at people who'd had low back fusions and got either cognitive functional therapy or manual therapy and exercise, good core exercises. So we're going to look at the details of this study and see what happened. So the interventions. So let's talk about the interventions first. They were 4 to 12 sessions, 60 minutes long. If you look at they were in private treatment rooms, so that means it was good fidelity of care. That they were able to provide what they anticipated providing, and they tried to do a really good job with it. The cognitive functional therapist, the physical therapist who did cognitive functional therapy, he had more experience than the other physical therapist, where he'd had 7 years of clinical practice with a lot of training and mentorship in cognitive functional therapy. And then the other one the one who did manual therapy and exercise, had 3 years of clinical experience and had done core training and manual therapy, but not necessarily a lot of specific training in each of those. So let's look and see what was done for each of those. So cognitive functional therapy, one of the main tenets of it was the therapeutic alliance is improved. They want to make sure they use empathy, mirroring, reflective issues, and reinforcement of adaptive behaviors. So if you're familiar with motivational interviewing, a lot of those types of techniques, making sure they're doing a good job listening, reiterating to the patient, meeting the patient where they're at. They also did exposure. It basically graded exposure. So you're not just saying we're going to go more and more no matter what you feel. They do a little bit more, make sure the person responds, and then making sure that they change the way the person views that activity by working on that exposure. So that's motivational interviewing, cognitive behavioral therapy, or what they term here cognitive functional therapy, making it very functional with that. No specific exercises were prescribed, just finding out the activities that are important to them and grading and exposing them to get back to their daily lives. And then lifestyle changes, basically helping them be healthier. And that's going to be incorporated, some of just education, but that's going to be involved with some of the motivational interviewing aspects of it. Then the core exercise and manual therapy. The manual therapy is some joint mobilizations. I don't think they said it, but surely not just trying to mobilize where the fusion was, but definitely maybe some myofascial work around there. Stretching, I don't know if that was to the back or to the legs. Joint mobilization is probably above and below the fusion. The exercise really where probably more of the effect was. As you can see, pretty good exercises. Cat camel working a little bit of mobility in a safe position, and working a lot of core exercises where you're not having a lot of core movement, or really minimizing the core movement. Also getting with some good leg exercises. So a lot of good exercises in this one. I would like to point out that it was adapted from this article back in 2022, where they did basically these same two approaches with people with chronic low back pain, and those results was that it was equivocal. It didn't really matter which approach that you had. In this research, they had 40 in each group, which is a pretty good sized group for research like this, and they were both about 50 years old, which we know is the peak incidence of low back pain. And some of them had multiple surgeries, some of them just had one. And let's look at the primary outcomes. So the primary outcome is pain intensity. As you can see here, the pain intensity at baseline improved more in the cognitive functional therapy group than it did the core exercise and manual therapy group, and it was significant. Also function, which was a secondary outcome, was also much better in the cognitive functional therapy group compared to the core exercise and manual therapy group. In both of the groups, if you remember back up here, they were pretty similar groups. So that's very meaningful. In Table 3, they had a lot of other secondary outcomes that they looked at, And basically all the same type of effect. Cognitive functional therapy outperformed core exercise and manual therapy. So I want to talk about the limitations and strengths of this. So they did admit the limitation is that they used one physical therapist for each treatment group. And remember that we talked about the one physical therapist that had more experience and more training, particularly with mentorship. And so then the question becomes, is that physical therapist just better at what they did? What if they'd had a lot of mentorship in core exercises and manual therapy, and over twice the amount of experience of the one with cognitive functional therapy? Would they have turned out differently? We have no idea, but what it does show us is that when cognitive functional therapy is done well, it can be quite dramatic effects. We should also note that the group with core exercise and manual therapy, an easier treatment group to be a part of, those people did have some improvements as well. Now, could that just be regression to the mean? It could, but they used exercises that are used in other research, so they're not bad exercises. Those could have maybe, what if we'd have combined the groups? That's something we don't know. But what we do know is that when you try to have a good relationship with a patient, you do motivational interviewing, you develop a therapeutic alliance, you see what's important to them, and you focus treatment on that. You work to make them a healthier individual. Those people do really well. And even better than when you get just really myopic and just do manual therapy targeted, near the lumbar spine, and exercises just targeted around there. But then when you do really try to hear that patient and target your interventions for them, that those people can do really well. So there's a good article with that. But what we don't know is if you're not very good at cognitive functional therapy, you haven't had that much training, and you just try to incorporate this versus what you maybe would normally do, or maybe you have more training in core exercise and manual therapy, what would those outcomes look like? We don't know. But it is nice to know that these patients do have the potential to get better, and the more we try, and the more we try to target it for them, and we are very specific in what we do, these patients can do quite well.